Welcome back to KickBack. I am so excited to be here at Altitude Coffee Roasters with Todd. Todd, thank you again for joining us today.
Yeah, I really appreciate the opportunity to sit down.
We're looking at your professional career and maybe how it's changed over the time from being in the inpatient mental health care to leading primary and community care here at the Grand River Community Health Center here in town on Colburn Street in Brantford. Can you just talk a little bit about the changes that you've seen over the course of your career?
Yeah, happy to do that. So I've been working in Brantford and Brant counties now for about 8 years. Previously, I was in the kind of the Waterloo region for the most part, and I was at BCHS in town and was the manager of the inpatient mental health unit for about 4 years. And so pre-COVID, into COVID, and then now what we're calling post-COVID, even though there's still all the fun things that we're dealing with. Yeah. But the one thing I've noticed in town a lot is that our patients and clients and the people accessing our services are continually more informed about what's going on, what type of help that they want, and they're coming with higher expectations, which is great. They're also coming with more complexity, and we hear that in physical health, but in mental health, it's very much the same as well. There's a lot of individuals who come with many things going on at the same time, all interrelated and all really challenging.
What do you think that is that's creating that more complex situation? I mean, it's interesting. I think that there's so much more like awareness and knowledge out there to be able to kind of navigate that and maybe self-diagnose a little bit about what they're experiencing and the shifts out there. But what do you think is attributing to those more complex issues? Like, it's interesting to me. Like, there's more complex issues, but they're also very aware of their like the options that they have.
Yeah, I think the core of it is that, like, societally we've shifted a lot. We actually talk about this. Right. We actually talk about mental health. Mm-hmm. This is a wonderful example of that. Right. Different strategies that have happened, and the fact that it's part of our regular language all the time. So I think some of it is just a lot of people that would never have tried to get help in the past are looking for it. So that's great. So there's a volume aspect to it. But then our ongoing opioid epidemic in Canada and Ontario and very much so in Brantford is extraordinary, and it's really challenging. And just the stress in life is more. Everything costs more. That leads to stress. Housing is much more challenging. That leads to issues. And even if you are very fortunate and have, a very supportive family and a great house and job and spare money on the side, doesn't mean that everything's going great for you. And you start to erode those other things, it just gets more and more and more challenging as time goes on. So it's kind of a big picture problem that is showing up in everyday life for people.
Yeah. Just really, the problems really snowball, and I think that people don't understand how close maybe a lot of people are to becoming homeless or to navigating those issues that they see that think they can't be affected by, but it's just kind of a few bad lucky breaks, and all of a sudden somebody may be without a home or might have a mental health episode or something along those lines.
Yeah. Like in the mental health world, there's stuff that's more on the situational end sometimes, where it's a compiling of different, more one-off type things that have all piled up. But then there's also that kind of chronic thing where you have depression and or like a psychotic disorder or bipolar disorders or all of those different things that are really challenging. And they all interplay, right? Like if it's very hard for you to get up and get moving in a day, it's also going to be hard for you to necessarily maintain employment. And if you can't maintain employment, then you have food and housing insecurity. And then all of a sudden now you're in a situational crisis, and it's this awful tornado of bad stuff. And it gets really overwhelming, and it's really understandable why it's overwhelming. And a lot of people in Brantford are a lot closer to that razor's edge than they've been in a really long time. So it's hard.
Can you share about what the RAM clinic is?
Yeah, so we have had a rapid access addiction medicine clinic in Brantford now for 6 or 7 years, maybe even more than that. And we've recently made some changes and relocated. So we're at 12 Market Street now. And we work in really close partnership with SOAR Community Services, CMHA in town, as well as Daytona Designated Aboriginal Health Center to deliver care for those seeking help with addiction and who require medications to do that. So we have physicians and nurse practitioners who will prescribe medications to try and support people with their cravings and with reducing their usage. And we do wraparound services. So we have counseling, peer support workers, addiction workers, people to support with housing in terms of getting you to the right places to find things, or trying to just make the night better and then catching up with you again the next day. So we are 12 Market Street, right in the pedestrian walkway, kind of behind Scotiabank, and we've been there now for since June, and up and running, and really enjoy trying to offer non-judgmental support. When people come in, we just want them to feel like there's a place that's willing to help them. Right. There's a lot around the area, but we really strive to make sure that that we're there.
Right, and I think that it's important, you mentioned off camera, the importance of being able to act fast.
Yep.
And being able to get fast and kind of strike when the iron's hot. Can you just share a little bit about what that means to an individual that maybe has approached that space and is like, okay, I need help.
Yeah.
Something's got to give. I need to change.
Yeah.
What does that look like?
Yeah. So as a recovering addict in recovery myself, it was one of the hardest things I've ever had to do in my life to actually ask for help. It took me years to get those words out of my mouth. And if the response that I had gotten at the time I asked for help was like, yeah, come back next week, I don't know whether I'd be in the spot that I am now. So we really want to be able to offer meaningful, impactful help at the moment that people are ready for it, because it's not a straight line. So bit of a curlicue. You might be ready, and then things may happen, and then you might not be ready. So when people ask for help, we really pride ourselves on being able to try and say yes. We may not be able to offer everything in that moment, but we try and offer everything that we can. And we put as few barriers in place as we possibly can. And I'm more of the administrator and one of the administrators that are involved, and I can say the staff there, doctors, nurse practitioners, peer workers, they keep me in line. Whenever anything comes up where they're like, hey, that's a little bit of a barrier, we don't want to do that. Their focus is really wonderful that way, to be able to help as fast as they can.
Right. And in general, for individuals that are struggling, what are the barriers that you see in our community?
Yeah. Access to help in a quick way, being able to kind of pull yourself away from your environment that might be contributing to ongoing substance use. So precarious housing, some of those types of things is really challenging. Mm-hmm. So doing work and going to a detox center and really putting in some hard hours to remove yourself from substances and start the process, and then you go right back into an environment where that's all that is around, can be really hard. So that supportive housing piece is really challenging in this community, especially with an addiction focus. And knowledge. A lot of people in the healthcare world, they're still really separating physical health, mental health, and even addictions can sometimes be in its own corner, but it's one person.
Right. So
we still have a ways to go to try and work on that. And as organizations, we are really trying to cross those bridges and eliminate some of those barriers and get people to the rightest place at the rightest time. But it's not always straightforward.
Right, and for somebody that's at home, the community member, you tend, I think you were alluding at it there, the idea of that these are humans, right? The people that are struggling are humans, and they deserve to be treated as such. And sometimes you can kind of put them in a different space and not see them as that. And how does somebody that's just the average community member support individuals that are struggling, or how can we support the system? Like what can people watching at home do to help?
Great way is to become more informed, if at all possible, about Learn. Like
Right.
there's programs out there, there's agencies out there that are built for supporting people around addiction, not necessarily people actively in and working through addiction themselves. So those family support programs are a great way to start, because it'll help you understand the person a little bit more, as opposed to some of the behaviors. Some of the behaviors are the things that get titled as, you know, the junkie,
Right.
and the problem, and the kind of the derogatory things that we say.
Yeah.
And it dehumanizes people. It turns them into why they're doing some of the, it doesn't look at why they're doing the things, and it just kind of is that label, and it's easy to jump to. Like, just being open and learning a little bit about the problem is going to help you address it a little bit more. And then asking, right? Like, there's a lot of times in the world we ask, hey, how you doing today? And we don't really listen for the answer.
Right.
But if you're interested, like, you can offer a little bit of help just by asking, if you're open to it.
Yeah.
We don't often have a lot of grace and understanding sometimes in our day to day. And I can understand why that is. But if we had a little bit more, and we took a little bit of time to learn about what others in our community are going through, it'd make a big difference.
Right. Well, thank you so much for the work that you and your team do, Todd. Really appreciate you joining me today.